Hi there, I'm Dr. Tahir. Thank you so much for joining me today. I'm a board certified pediatrician, and today I'll be talking to you guys about a very important topic, and that involves congestion and pressure and pain in the sinuses. I see a lot of patients coming in with this concern, and that's because a lot of different things can cause problems like that. For example, if you have a cold, a virus infection, for example, or an upper respiratory infection, that can cause swelling of all of the linings that we have inside our nose that causes congestion, causes a lot of mucus production. We have the same linings inside our sinuses, which are hollow spaces or empty spaces in our facial bones. So there's hollow spaces up here. These are the frontal sinuses. There's also hollow spaces behind our nose, deep into our skull, and also spaces in our cheekbones, and that's called the maxillary sinuses. So when we catch a cold, for example, and we get swelling or inflammation of the skin in our nose and we get congestion and runny nose, well, the same thing is happening in the linings of the sinuses. That can cause pressure buildup in those areas. And sometimes when the openings of those little spaces are clogged with mucus, for example, or swelling, there's nowhere for that pressure to go, and that causes a lot of pain and discomfort if you're experiencing that. And so when you have sinus congestion and pain, you might be getting headaches, you might be getting pain in your cheekbones, you might be getting pain and pressure behind your eyes. Have you seen sometimes, or have you yourself seen yourself sometimes sit there with a headache and put pressure on your head, or sometimes over your bones or your cheekbones when you have a cold or congestion? Well, you're kind of doing something I'll be talking to you guys about today. And that's helping to relieve some of that pressure. Along with colds, allergies can also commonly cause congestion and pain like that because they also swell up the lining of your nose and the sinuses. So allergies are very common. Sinus infections also can be a problem. Sinus infections happen when a virus or bacteria infect the linings of your sinuses, and that can cause a lot of pain or pressure too. Most of the sinus infections are actually viruses, and they go away by themselves, but sometimes you need antibiotics for treatment. There's lots of ways of treating congestion, pain, and pressure. So, for example, if you have a cold, you could try taking some decongestant medications if you're old enough, or if your child is old enough for that. You can also try spraying some nasal saline spray in your nose, and that helps to break down the mucus. That may also help decrease the congestion and the pressure that you guys might be feeling. If you have allergies, for example, you might need to take an allergy medication. So that helps decrease some of the swelling in your sinuses and also your nose. There's also allergy nose sprays that you might be able to use. So depending on what's going on, different medications can help you with that. There's also essential oil that you can use and essential oil inhalers that you can use, but that's a topic for a different day, okay? So those are some of the things that you can use to help decrease some of your pain. You can also use pain medication, of course, and that is ibuprofen, which is commonly known as Motrin, or acetaminophen with a common brand name of Tylenol, for example. So you can use those for pain too. Now, whatever you do, whatever type of pain medication or other treatments you use for pressure of your sinuses, there's also one more thing that you can do that will potentially help you a lot, and that is doing some sinus massages. Massaging of the sinuses can help relieve some of the pain that you're having and pressure you're having immediately. As part of the sinus pressure pain that you might feel on the nose, a lot of times people get congestion of the ears and ear pain too. So today I'll be showing you a technique about ear massages too. There's a separate video that I made on this a long time ago. And that video about the ear massage technique is actually one of the most commonly watched videos I have on my channel. I'll put a link on that video down below. But for today, I want you to also incorporate that as part of a sinus massage technique, all right? So now let's talk about the sinus massages. Basically, what you'll be doing is using hand pressure and finger pressure to press gently on your sinuses. Not so hard that you're gonna get bruises and leave fingerprints on your skin, but not gentle enough that it doesn't do anything. You have to put a little bit of pressure on so you feel some resistance, and also you'll feel the effect of this right away too. Effect might include lessening of your pain. It might feel like less pressure, And that happens because there is drainage happening of fluid and also air through the passages that might have been blocked. So to do this, I'll be taking off my glasses so I can show you easier, okay? First, what you'll want to do is gently rub your fingers together in case your fingers are cold, or you can put your hands under some warm running water just so that your fingers are nice and warm. The warm temperature will also help with the massage and may also help with the drainage, okay? So first thing you'll want to do is, with your fingers nice and warm like that, take the first 3 fingers and put your fingers on top of your frontal sinuses, which are going to be above the eyebrows and toward the center of your forehead. So think about this area here on both sides, okay? About that area. So what you'll do is put your fingers there, press onto your bone of your head or your skull, and simply keep pressure on there for about 10 seconds. 6, 5, 4, 3, 2, 1, and gently let go. You can also put pressure right over here by your temples and you press kind of inward. So 1, 2, 3, 4, 10. And then also take your thumbs and put pressure on the ridges of your eyebrows. So that's the bone that's above on the top here of your eyes. And push upward and inward. So you'll be going like that a little bit. So use both your thumbs and put some pressure upward and inward toward the center of your forehead with both your thumbs for about 10 seconds. And that helps with the sinuses that are up here, the frontal sinuses. You also have sinuses that go deeper into the skull and that are behind the bridge of your nose. So for that, what you'll be doing is putting pressure and some compression on the bridge of your nose. That's the bony part of your nose that's right up here. That's about the upper half of your bone. So putting pressure down here is not really going to help that much. You can't talk very much like that, but putting pressure up here is the key. So that's the bony part of the nose. To do that, there's a couple ways I found helpful. One is you simply pinch your nose with your thumb and your middle finger, or and your index finger. So I usually like to use the thumb and the middle finger. I can put better pressure with that. And what you'll be doing is kind of grabbing just the very top portion of your nose just before the eyebrows start here. And you simply compress your nose inward and also push it back a little bit toward inside of your head. Okay, so you'd be pushing it in your head and also compressing it a little bit, and hold that for about 10 seconds. 6, 7, 8, 9, and 10. The other way to do it is use both your fingers like this, both your hands rather, and compress on your nasal bones, on the bridge of your nose, and inward and also upward a little bit, okay? So you're kind of directing pressure in and up. So we'll go like that. 2, 3, 4, 9, and 10. The next sinuses you want to target are your maxillary sinuses, and those are the sinuses that are behind your cheekbones. The cheekbones are the bones that you feel directly underneath your eyes and above your jaws. These cheekbones have spaces inside them, which are the maxillary sinuses. So these are common sites of infection, by the way. So what you'll do is put your pads of your fingers on both your cheekbones and just press inward like that. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. You can also press inward. So starting on the sides a little bit, just press inward like that. So we'll do that for about 10 seconds. 2, 3, 4, 5, 6, 7, 8, 9, and 10. All right, so that targets the sinuses up here, the sinuses behind the bridge of your nose, and the sinuses inside your cheekbones, okay? The other thing I want to show you that's really important, and there's a separate video about that, which I made, and I'll link it down in the comments below, is massaging the area of your eustachian tube. That's the tube that connects the ear to the back of the nose or the throat. And that goes inside the skull. And when that gets clogged, ear gets pressure and ear gets clogged also. So the massaging technique for that is you take your fingertips, and if you put some olive oil or some kind of massage oil on your hands, it might be easier because your fingers will slide across your skin. And so what you do is you put your fingers behind the ears like that, and you gently rub downward. You put some pressure in towards your neck, and you slide your fingers down to the angle of the jaw. Just like that. The angle of the jaw is where your jaw is changing from going mostly down to front. So this corner right here is the angle of the jaw. So you'll take your fingers and you move simply down like that. There. Now what's nice is you can do both sides together at one time. And you can do this for yourself, or you can do this for your child. I show a lot of parents how to do this when I see their kids for ear infections and ear pain. And most parents don't know about this at all. And it is shocking how many people this has helped. So making the ear massage technique as part of your sinus massage technique is very helpful because it helps to decongest all the common areas that we get congestion at. All right? Thank you so much for joining me today. I hope that you found this video helpful, and I hope these techniques help you and your kids feel better. If you like this video, make sure that you press like on the video and also share a comment of your experience. Please share this video and channel with your friends and family. Have a wonderful day. Bye-bye.